Physical activity and breast cancer. What does the research say? Have you or someone you know been diagnosed with breast cancer? This can be a scary time, and you can feel like you don't even know where to begin with the questions you want to ask. It's common to feel overwhelmed by the sheer amount of information available. You may not know what sources to believe. When it comes to academic papers and research, this can be even more difficult to tackle because you don't want to read 30-page papers written in academic jargon, and perhaps you don't even have access to the larger journals online, since they're definitely not cheap or free. This is where I come in. This video is going to give you an introduction into the research being done on the relationship between physical activity and breast cancer. The focus is going to be on how exercise can impact breast cancer survivors after they have been diagnosed with cancer and have undergone treatment, so more of a focus on long-term impacts. Let's begin. Did you know that in Canada, 1 in 8 women are expected to develop breast cancer during their lifetime, and 1 in 33 will die from it? While a stat can be terrifying to hear, the good news is that with the improvements in cancer research, less and less cases are leading to death. This is where physical activity comes in, because now we have more breast cancer survivors, and we want to ensure that their quality of life is high for the rest of their lives after a cancer diagnosis. It has been found that walking 3 to 5 hours a week at an average pace can decrease the risk of death from breast cancer significantly. It seems that light physical activity is safest for breast cancer survivors because higher intensities have been related to respiratory tract infections, instead showing that more exercise, in this case, is not always better. On top of this, physical activity has been found to reduce the risk of breast cancer, reduce the risk of reoccurrence, and increase the survival rates from breast cancer. One disclaimer I will give is that there is still minimal research that is focused on women with the BRCA1 or 2 mutation, so I can't say with confidence that physical activity helps these specific cases, even though there has been a few studies that have shown they have similar effects. One meta-analysis found that all levels of post-diagnosis physical activity reduced breast cancer mortality by approximately 30% and decreased all-causes mortality by 41%. This is great, but how does physical activity actually help? The research is showing multiple different mechanisms that it helps, such as how exercise impacts sex and metabolic hormones, adipokines, the immune system, and oxidative stress. If you're interested in more details, these studies will be shown in the description box below. Additionally, physical activity has a positive effect on all of these factors. Again, information will be at the bottom, as I won't go through each and every one of these. On top of this, there are a few different hypotheses on how physical activity plays a protective role in mortality for breast cancer survivors. Firstly, as we know, physical activity is just good for you and leads to decreased mortality even without breast cancer. So if you're physically active throughout your life, you'll have a decreased lifelong estrogen exposure, augmented immune function, and lower body fat, which are all linked to decreased mortality rates for breast cancer survivors. On top of this, physical activity is one of the main determinants of insulin resistance, and research has found that chronically elevated insulin levels lead to breast cancer. Also, the second most common cause of death for women with breast cancer after the cancer itself is cardiovascular disease. This is because the treatments such as chemotherapy, radiation, and hormone therapy also negatively impact the heart and cardiovascular system. So physical activity is promoted as a possible intervention to offset the risk of cardiovascular disease after breast cancer treatment. Not only does physical activity positively impact all these physiological mechanisms mentioned, but it also has been found to improve self-esteem, quality of life, and decreased anxiety and depressive symptoms for breast cancer survivors. Specifically, one study found that women with breast cancer who were physically active reported lower levels of negative symptoms such as feeling sad and feeling irritable at 16 weeks after chemotherapy compared to the physically inactive group. For a more holistic approach, one study looked at how breast cancer survivors will use exercise as a spiritual practice in their journey to self-transcendence, which is very closely related to mental health and becoming self-actualized. Overall, now hopefully you understand why physical activity can be a very helpful tool in your journey as a breast cancer survivor. Before ending off this video, I want to remind you that the most effective exercise programs are individualized to your needs and your experiences. Please speak with your oncologist before doing intensive exercises, and even ask if they can perhaps refer you to a physiotherapist or kinesiologist so that you can work together to create a program that works for you and will actually have positive impacts on your health. Thank you so much for watching, and if you are interested in learning more, all the references used in the video are in the description box below.